Hi everyone, Vijay here. Today we're going to talk about what you receive in the goodie bag post-surgery and the correct use of the ultrasonic toothbrush, the water flosser, and the correct use of the Blue M mouthwash, which we provide you as well post-surgery. So just to relate this stuff to what's in your mouth. This is the toothbrush, Sonicare. The reason that we use a sonic toothbrush is very simple. We use it because it ultrasonically vibrates along here. And this is where we want you to brush. I'll tell you where we don't want you to brush, up here. We never want you to brush up here, ever, ever, ever. Brushing the gum is a nonsense, and whoever tells you to brush the gum does not understand implant rehabilitation. Never, ever do it. Otherwise, you will destroy the fragile interface up here, and that will be on you, and it's very easy for us to spot patients who've been brushing the gum. Stay here. If it's not on something that looks like a tooth, you are in the wrong place. That's the easiest rule of all, okay? The ultrasonic makes the whole prosthesis vibrate, and actually vibration is more effective, ultrasonic vibration is more effective than mechanical abrasion. Mechanical abrasion, just like all abrasion, will wear things away. Ultrasonic vibration, on the other hand, which is extensively used by orthopedic surgeons to improve the healing of a hip replacement. They use it, little boxes they put on here, using ultrasound, vibrates, and it vibrates at a frequency which automatically dislodges bacteria. That's why it's important. Do not use this until you get to at least 3 weeks. Before that, use a manual, baby soft toothbrush to gently clean this area and stay away from the gum completely. That's very important. Let's talk about the next item, the water pick, the jet washer as I like to call it. And it works like a jet washer. You point it up here and it just shoots jets of water around. That's it. It is for macro food removal, little bits of food. But I'll tell you, once the gum is healed, even more effective than this is a cup of tea, right? So if you've forgotten your jet washer, get a cup of tea, because it'll do the job really well, because the prosthetics are designed to be self-cleansing, and really the mouthwash we want is not Blue M. Blue M releases oxygen, which helps us with healing. Is it a good long-term mouthwash? Absolutely. But it's also expensive and difficult to find. And I can tell you from my 25 years experience, people who just rinse with warm water have the equal measurable results to this, and the main variable is not the mouthwash, it's the design of this prosthesis. So let's talk about that. The way this prosthesis is actually designed is the surface, the fitting surface, is convex. So it's that shape. What it isn't is that shape. That shape over the gum means food will get stuck and you can't get it out. It's that shape against the gum, which is a U shape. And the reason for that is so that it narrows as it approximates the gum. Now you will feel a gap with your tongue, but it's actually the contour that is absolutely correct for any prosthesis for full jaw. Anything that laps over the gum is grossly unhygienic and will definitely destroy your implants over time. And we here at 21D definitely won't do it, no matter what you say. Why is this important? This convex surface is designed so saliva can always access this. You've got millions of saliva glands in your mouth, and it is and always will be the best mouthwash for you, because it is the only mouthwash in the world that carries antibodies. And antibodies are very effective at neutralizing the nasty bugs. So chemicals aren't anywhere near as effective as antibodies. If you're not using Blue M, try and avoid basic mouthwashes because they're actually acidic. They are acid-based mouthwashes, they are chemical-based mouthwashes, and we don't actually like them. We know something about our prosthetics. The mechanisms of plaque that affected your teeth are not the same as the mechanisms of plaque that affect this. The most vulnerable areas are not in between the connections, they are only the connections themselves. And the connections themselves that come through the gum are only 0.5 centimeter wide, which is much narrower than any tooth you've ever had other than your baby teeth. Your adult teeth are at least double and some are triple the size of this. So the surface areas are much larger. These surface areas are much smaller, and note, they are distributed very wide apart. So we haven't got 20 implants going on, which is why we don't put more implants than we actually need per patient, because we want the spacing for self-maintenance. So these are the 3 items that we give you. Always use a sonic toothbrush, apart from the first 3 weeks when you're using a baby soft toothbrush, and always stay on the tooth part. You only use your water irrigator after 3 weeks. Until then, just stare at it in the box. Blue M mouthwash is excellent for healing. And if you win the lottery, by all means, buy a pallet full of Blue M. Otherwise, my recommendation, if you want to keep life simple, lukewarm water. Some people talk about adding salt to the water. You can on healed tissue, but salt is a mild antibacterial agent, but it's also an irritant. So we want to avoid it. Lukewarm water is not an irritant, which is why I just like lukewarm water. And if you find yourself on holiday and you forgot to bring your irrigator, order a cup of tea. That'll do the job very well. These things are incredibly robust in self-maintenance. So please follow the rules that we give you and stick to the timelines of use that we've given you, and never brush the gum area. Stay away from the gum area with a toothbrush. You are damaging your own prosthetic setup. Thank you very much.